Kyle from Adapt Performance and Rehab. Today I want to talk to you guys a bit about why and when it might be important to get an MRI done or an X-ray done for an orthopedic injury that you're facing, and conversely when it actually might not be appropriate to have that done, and exactly why that might be the case. So I can understand how it can be a really tough decision to make when you're not quite sure whether you'd actually benefit from getting this done or not. A lot of times doctors and just medical professionals like to push to get it done, that way you have a more concrete answer. However, I'd like to explain to you why and when it might actually be appropriate, and by the end of the video I want you to be able to have a good idea as to should you actually get this done or should you not get this done. The first thing I want to go over is when and why it might actually be appropriate to have medical imaging done. So that would include something like an X-ray, an MRI, a CAT scan. There's various different ways that they might do this, and each of the different types of images would tell them something different about your injury. So the first thing I want to go over is if you were ever in a direct trauma-related injury, so let's say like a car accident or a head-on sports collision, or you fell down the stairs or something like that, that kind of trauma can create an issue where sometimes doctors will want to go in with an image just to make sure you haven't broken something or tore something like that. So that might be a reason that you might want to get it done. The second thing is, if you've experienced pain for multiple years and you've kind of just been chasing it around for a while, sometimes it's hard to tell if there's something small going on in there, and that might be another reason that you might want to look into getting an X-ray or an MRI or whatever imaging done. The third thing, and this is a pretty important one, is whether or not in the past you've had physical therapy that did not succeed with reducing your pain and improving your functional ability. Now this gets tricky because all therapists are kind of created differently. They're not all equal, just like all doctors aren't equal, just like all lawyers aren't equal. So you want to make sure you went to a physical therapist that took the time to work with you. I mean, one-on-one, hands-on, really gave you the time of day and really worked hard to help you manage your pain. Now, if you didn't have that done, or if you did get that kind of a treatment and you weren't able to see any sort of relief, that might be another reason that you might want to get some sort of medical imaging done. The third thing is, if it starts to affect your functional abilities, that might be another reason. So let's say you've been going on with this for years and the injury hasn't gotten any better, and now you're getting to the point where doing everyday stuff is becoming really difficult for you, that might actually be another reason to get it done. And the last thing I want to go over, another reason that you might want to get this, is if you've gone to a doctor or a physical therapist or anybody that's done some sort of testing on you, and some of the tests are looking positive, that might be an indication that you've either torn something or broken something that might need immediate repair. So that might be another reason to get an image done, just to take a look and be able to say for sure, did you tear something, did you not, is everything intact, that kind of a thing. Now, pros to getting that kind of an image done would be first and foremost, ease of mind. Now you know exactly what's going on. You know you've had all these things going on. Now you've got a picture that's showing you exactly what's going on, and that might actually help you decide where you want to go from there. Another big reason would be, if you're kind of at the point where this injury is taking over your life, it might help you determine whether or not a surgery is actually appropriate in this instance. So then having an image or having some sort of MRI, X-ray, whatever it might be, might actually then lead us into, does this look like it needs to be surgically repaired and dealt with, or can we avoid that? And then the last thing would be, if you do get that image done, it might actually tell you the severity of it, and then you can decide if you want to go all in with the physical therapist, because surgery is not warranted in that situation. So it might help you come up with a more concrete plan of care at that point. So now I want to go over the reasons as to why it might not actually be beneficial to get any sort of medical imaging done. Now, I want you to make sure you stay tuned to the end of this, because my last point is definitely the most important point. Okay. So the first thing I want to talk to you about is that going in to get imaging done can actually delay the start of your treatment. So let's say you go in, your doctor, you spend the time, it takes about 2-3 weeks to go see your doctor. You go in, the doctor says, I want you to get an MRI done. They schedule it for another week later. You get the MRI done. If you didn't know this already, now you know it. It can take about a week to get the result for the MRI back. You could now be out about 10 weeks until you even start your treatment. So it can be important to make sure that the second an injury starts, that you make sure you get into the hands of the appropriate person quickly. Because if you're waiting on an MRI before you start treatment, you just let that injury sink in for weeks and weeks until you actually got any sort of treatment going. The second thing I want to talk to you guys about is the price of the cost of actually getting this imaging done. Now, a lot of people are finding that their insurances are doing a good job covering it. However, because they're being overutilized, you'll notice a big shift even from 2017 to 2018, where insurances aren't actually right off the bat saying that they're going to cover any sort of imaging anymore because it costs them an arm and a leg. So you could end up spending thousands of dollars out of pocket just to get a picture and not actually have it say anything conclusive on it. So it's worth making sure that you're actually putting your money exactly where it should go, whether it's into the good rehabilitation to make sure that your injury is fixed, or whether it is getting an image that's very necessary for you. The third thing is exposure to radiation. This is a big one these days where with radiation being a bit of an issue as far as environmental stuff is concerned, a lot of people like to avoid any sort of excessive exposure to radiation. And if you find that you have to undergo multiple MRIs or multiple CAT scans or X-rays or whatever it might be, you might want to minimize that risk when you don't actually have to put yourself. The fourth point I'm going to make, and this is the big take-home point, is that the results of your MRI or your image won't actually always show you where the source of pain is actually coming from. So this being said, an image is actually just a snapshot image of what's going on in your body. It doesn't actually show if when you start moving, you're creating pain or unnecessary shearing or compression or anything like that. So there's no movement associated with a lot of these images that people will take. And for that reason, you won't actually know if what's coming up on that MRI is the source of your pain. Now, for example, there's a lot of studies that have come out lately where they'll take images from people who are perfectly healthy, and I'm talking 0 out of 10 pain throughout their day. And they'll take these images and they're realizing, some of these people come back with huge rotator cuff tears, or they're coming back looking like they have huge bulging discs in their spine, and doctors are it's making them question, is the pain actually coming from these issues, or is there something else going on movement-wise that's actually causing them to have pain? So this is why I always tell my patients, and I want to educate you on this too, take your MRI and your X-ray with a grain of salt, meaning just because it shows something doesn't mean that that needs to be surgically fixed. You can be a perfectly healthy, perfectly active, perfectly functional person without having to go in there and surgically repair something, as long as you're moving properly. So that being said, if you do go in to get an MRI, just know that, a big con to this is that it might not actually show you what needs to be fixed. Now, for that reason, I think that going to a physical therapist is super important, because that's somebody who can help get you moving again properly. And if it is a movement disorder, if there's something going on with the way that you're moving, and if it's abnormal and it's causing pain, a physical therapist would be the best person to help you fix that. So there you have it. So essentially, by the end of this, I want you to be able to kind of decide for yourself, does my injury sound like it needs to have an X-ray or an MRI? And should I go talk to a medical professional, my doctor, my orthopedist, about getting something like that? Or do I want to take a step back, go see a physical therapist, and see if we can kind of get this going without needing any sort of X-ray or MRI? And the cool thing about this is that your physical therapist can then do the screen again and decide, no, you know what, I think you might benefit from getting the imaging, and then send you to a doctor who can help take care of that. And the other thing is, if you do try physical therapy, and let's say in a week or two it's not really giving you the results that you need, the option of getting imaging is always going to be there. That's never going to go away. And most insurance companies even like to see that you've already gone through physical therapy before they then pay for imaging. So it's always good to kind of go that route and think in that route, unless the imaging is something that's absolutely needed, like I talked about in the beginning. So I hope you learned something. If you have any questions, or if you're not quite sure whether or not you might need imaging done, you can always reach out. If you visit our website, the link is in the URL or down in the info. If you visit our website, you can always schedule a free 30-minute consultation with me, and I'd be happy to take a look at everything and just let you know my opinion. But I hope you learned something. I will see you guys next week. Bye.